Hello everyone, this is Usama Naga. I'm very excited to announce that we'll start our new live pediatric board review course on Sunday morning next week, April 5th at 10 a.m. New York time or Eastern time, and the course will be delivered via Zoom. You are welcome to join us at any time, even if the course has already started. In this video, I will go over pediatric board study plan in general. Step number 1 is to choose the right resource. Choose the right textbook to study from now, and avoid switching between books as the exam approaches. This will be confusing. Choose a book easy to read, easy to retain, easy to review. One book is highly recommended, written by myself, is the Pediatric Board Study Guide, a last-minute review. This book is easy to read, easy to retain information. It has the last chapter, last-minute review, with over 2,000 cases. Very highly tested in the board exam, so not to miss that. Step number 2 is to start early. This is the right time to start, at least 6 months before the board exam. Board exam is not so simple to start 1 month before, so start now. This is the right time. Step number 3, to answer questions. You study one subject, you answer questions after. Study and read and answer the prep questions in the last 3 years by American Academy of Pediatrics. Very important to know what the pediatric board really wants you to know. They go around 3 main items. Item number 1, disease prevention and complications. Number 2, not to miss a critical diagnosis. Number 3, to provide the right management, not to overtreat or undertreat. I will give you example for number 1, prevention of diseases and complications. The board wants you to know the vaccine schedule and catch-up schedule by heart, so practice that from now. How to prevent anemia in children, lead poisoning, to screen for diseases. Not to miss a critical diagnosis. For example, if you have a child with fever 5 days or longer, the right management is to investigate. This child may have Kawasaki disease or even leukemia. So the board wants you not to miss something like that. So reassuring the parents in this case is the wrong answer, wrong management on the board and in real life. Also to provide the appropriate management, not to overtreat or undertreat. For example, if you have a child with supraclavicular lymphadenopathy, the correct management is biopsy, not reassurance. On the other hand, if you have a child with anterior cervical lymphadenopathy, small, tender, with viral pharyngitis, the treatment is reassurance, supportive care, not CT scan or ultrasound. And next week, we'll start with genetics and neonatology. And once you register, we'll send you in the email the question bank, last-minute question bank for these subjects and the handout. It's highly recommended to read them before and study before the course. This will make you more engaged and more prepared, and will help you to retain the information faster and to ask appropriate questions. Study daily from now, and practice in your patients. Practice developmental milestones, normal or abnormal. If you have a child, practice in your own child. Practice in your patients all the time. Practice vaccines in your clinic. Practice vaccines when you are admitting patients, when you ask about vaccines, if he's up to date or she's up to date or not. Register now, and we'll see you next Sunday. Thank you.